Hello, my name is Iris Barahona. I will be talking about the risk factors of syphilis. So, despite all the health prevention programs accessible to the general population, oftentimes people do not access treatment at the early stages of syphilis due to various factors such as accessibility, availability, and acceptability of a given population or geographic location. The topics that will be covered are what makes people most vulnerable of contracting syphilis, what are some background barriers that prevent syphilis treatment, how does socioeconomic status and education play a big role in acquiring medical treatment, and what are some prevention programs available for syphilis. What makes people most vulnerable of contracting syphilis? Well, first of all, the sexual promiscuity and the sexual behaviors of different groups based on their race, genders, and age groups allow syphilis to be more prevalent within the different ethnic groups. Consequently, syphilis is prevalent in minority population, predominantly in the African American, Hispanic, and bisexual male population, which are higher at risk of acquiring syphilis. In addition, vulnerable subgroups contracting syphilis are people ranging from 18 to 29 years old, men who have sex with men, sex workers, transgender individuals, and bisexual individuals. Um, Other significant factors, such as the use of illicit drugs during sex, poverty, and other STI infections, trading sex for drugs or money, and sharing needles also contribute um, in contracting syphilis. What are some background barriers that prevent syphilis treatment? The most common barriers that prevent people from seeking treatments are the lack of knowledge in regards to the severity of syphilis, not knowing where to seek treatment that is free or low cost, shame associated with seeking treatment, long clinic wait time, discrimination. People tend to worry about what other people might think of them and criticizing them on the sexual promiscuity. How does socioeconomic status and education play a big role in acquiring medical treatment? So we all know that socioeconomic status is an important factor because it underlines the three major determinants of health, which are the healthcare, the environmental exposures, and the health behavior of an individual. A low socioeconomic status implies not having the basic health insurance coverage met, which means that oftentimes the insurance does not cover all the medical treatment and individual needs. So there's that health disparity factor between a person with a low SES and a high SES. So a person with a high SES has a broader medical treatment services available to them because oftentimes their insurance will cover most of their medical treatment rather than the person with a low SES has oftentimes that barrier or that restriction um, based on their health insurance. And then another factor is also education. We all know that education leads to better paying jobs and a higher income, which in turn leads to a better health insurance that provides an individual with um, better medical treatment and pretty much covers most of the health related services that an individual needs. So then also a person with more education, that individual is more aware of the health risk associated with practicing safe sex, rather than an individual with a minimum education. They have minimum health knowledge, if any, um, and are not really aware of the seriousness of contracting syphilis and seeking treatment promptly. And also, the lack of education is a direct factor of the irresponsible health behavior of an individual. So, what are some prevention programs available for syphilis? So, pretty much the county hospitals and the community clinics offer primary, secondary programs that can be easily accessible to the general population with free or low cost services. So, the services provided are the primary level of prevention, which is aimed to prevent the illness from progressing or even occurring by providing condoms and health literacies. And also, they provide counseling in order to prevent sexually transmitted diseases. And then the second level of prevention is aimed to reduce the progression of the disease by providing effective diagnosis, treatment, and then again counseling to the infected individuals. And lastly, the tertiary level consists of helping people manage the long-term effects of the problem associated with syphilis. Individuals are provided with periodic checkups and medication therapies and counseling. Thank you for watching. These are the references.